Good afternoon. Thank you all very much for joining us at the beginning, prior to the start of the Criminal Justice Commission meeting. Our goal at Metro Council is to make Louisville a safer, stronger, and healthier city. And our most urgent focus is on public safety. As I've said many times, we're not waiting when it comes to making reforms and improvements to LMPD. We've made multiple announcements about this work. You've seen their hard work in action, and there'll be many more announcements and action to come in the coming weeks and months ahead. And of course, public safety involves much more than just our police department. It's a community-wide effort that involves all of us. And within the context of Metro government, one area of public safety also includes is that of Louisville Metro Corrections. And this is another area where we've all agreed that reform is needed as well. The challenges in our jail and Metro Corrections are well documented. I was aware of them at an initial stage when I was sworn in as mayor in January. Had many conversations with Daniel Johnson, who leads the members of organized labor that work here in the corrections department, and hearing from them about what some of these challenges are. Many of these issues in corrections were detailed in a report presented to Metro Council last week. These challenges are the result of a variety of factors, some of which will take time to fully address. But again, we're not waiting. We're taking action. We're taking action now to bring some seriously needed reforms and improvement to Metro Corrections. Today, I'm announcing the first 3 steps in what will be a sustained effort to improve safety for corrections residents and staff, provide more effective mental health treatment, and offer greater transparency to our community. I'll detail each of those one at a time. First, we're making dramatic improvements to our triage and intake processes for residents when they first arrive. Metro Corrections has always included some mental health questions in initial screenings, which are conducted by a registered nurse. These screenings rely on patients self-disclosing mental health conditions. From now on, initial entry screenings will include much more in-depth psychological evaluations, and will have master's level clinicians available 24 hours a day to conduct these evaluations. This improvement will allow Metro Corrections to more quickly connect residents with appropriate treatment and resources to address their mental health needs. We know that the delivery of effective mental health services is absolutely critical to maintaining a safe environment for residents and for our team. We can only help people when we know what kind of help they really need. So this is a simple but critical change that can produce better health and safety outcomes for our entire population and staff. And of course, we also recognize that we have to do more to safeguard the physical health of Metro Corrections residents as well as their mental health. That brings me to my second announcement. Metro government will soon be issuing a new request for proposal, an RFP, for healthcare services at Metro Corrections. The RFP will cover healthcare services beginning once the current contract with our current service provider, WellPath, expires on July 31st of this year. The RFP has been developed with significant community input. It's designed to address the changing needs of population that Metro Corrections serves and to incorporate new approaches to care delivery. For instance, this RFP is ideal for a healthcare partner that can provide care with additional emphasis on mental and behavioral health, treatment of substance use disorders, and medical detoxification. And for my third announcement today, there have been numerous calls in recent years for greater transparency from Metro Corrections and from all of Metro government. I've heard that. I agree, and we're responding. I'm announcing that Metro Corrections will release a new tool to provide greater transparency. It's called the Louisville Metro Corrections Dashboard, and it's live online right now. This dashboard provides real-time information to the public about who is residing in Louisville Metro Corrections. It will offer daily updated infographics on the corrections population, including gender, race, length of stay, category of charge, amount of set bond, and other information as well. We're taking this step because rebuilding trust with the community is a top priority for Metro Corrections and all of Metro government. One of the ways we want to do that is allowing the public unfettered access to information about our corrections department and how it operates. I want to give a special thanks to the members of the Jefferson County Criminal Justice Commission who are here with us today for their incredibly hard work in making this dashboard a reality and the information that it contains available to the public. Thank you all so very much. I'd also like to thank Louisville Metro Department Corrections Director Jerry Collins, who has been working with us towards these improvements that we're announcing here today, and who he and his team will be working together to implement these improvements over the coming weeks, months, and years ahead. Director Collins has been very involved in the process of crafting these reforms, and he and his staff are working very hard under difficult circumstances to serve residents and the people of Louisville. So next, I'd like for you to hear from Director Collins himself. Director Collins?
Thanks, everyone, for coming. I think this is very critical. One of the things that the mayor touched on, which is 100% true, is we couldn't wait, we didn't wait, and we're not waiting. We're moving forward with many reforms. Many have to do with the folks that are incarcerated, to include master's level mental health clinicians that will see everyone that is incarcerated in the jail. In addition, in the last month, we've started telehealth, and what that allows the nursing staff to do is to access a doctor 24 hours a day within 3 minutes. That's been used 56 times since March 1st. So that is a great improvement there. In addition, one of the issues we were having as far as health and complaints is how fast someone would get their medicine. So we adapted a Cerna app that the medical staff used, and instead of days verifying prescriptions, it's a matter of hours. So again, another critical change. All these things are going to continue to happen. Obviously, you guys know we have a challenge with that. In addition, I forgot one thing. Last Monday, we started a full-time MAT nurse, medically assisted treatment, to increase our detox rounds doubled. So they're full-time. We're introducing Suboxone to folks that have that prescribed on the streets, and that just started. So it's another huge change for not only the physical but the mental health of the folks that are incarcerated in our jail.
Thank you very much, Director Collins, and we're happy to, either one of us or Deputy Mayor James, we're happy to take any questions that you all might have briefly before the Criminal Justice Commission meeting begins.
Mayor, what would you say to taxpayers who've been paying for a jail that has been, in your words, it's had well-documented problems? Taxpayers have been funding this for years and years now. And I know you're making changes, but what would you say to the taxpayers who've been paying for a jail that is maybe not up to certainly your standards?
We hear you, and I agree. That's why just over 100 days into my administration, we're here today announcing reforms and improvements. We're not waiting. We're taking action.
What do you plan on doing for the houseless community that are resigning in jail? What can we do to get them out of jail from resigning into a successful housing situation?
Well, when an individual arrives here, we don't treat them any different regardless of what their housing status was prior to being brought to corrections. Our administration is very focused on creating more service and shelter for those who are currently experiencing homelessness, and we have announced tens of millions of dollars already in new affordable housing investments that we've made. We've announced a new project, which we think will be an innovative national model at the community care campus. And in my budget presentation, which I'll be proposing next year's budget to the Metro Council next Thursday, you and the entire community will see continued investments in affordable housing and in services and shelter support those who are currently homeless. This is an issue that we are also very focused on in our administration.
Mayor, a big part of what David Byer said weeks back in front of council was that a new facility is needed. I know that is kind of out of the question at this point. How much of these policies are to make up for the fact that a new jail is just not feasible right now?
Yeah, right now, Isaiah, we're very focused on reform and improvements with the existing facility that we have right now. So that has been our focus. We have urgent needs that are right now in going on in our corrections department in the building that we currently have. So that's what we are focused on, and that's what you're hearing about today.
Can you talk about the use of Narcan in the jail? That report showed that it had been used 69 times since last April, and I understand there's talk of potentially having a vending machine made available for when people are leaving the jail to have that available as well. Can you talk about just the use of Narcan and the expansion of the use of Narcan?
Yes, one of the huge, obviously, problems we had when we came back was overdoses due to fentanyl. A huge life-saving measure we did early on was put Narcan and Narcan alarms in every dorm in there. Now it's a little misleading on the use of Narcan because it could be one person and used 5 times. But yes, we have that, and it saved lives, and that's very important. As far as the vending machine, yes, we have worked with some folks, and that will be going into our exit lobby along with education material for that, in addition to other things in that machine for folks that are exiting the facility.
Thank you all very much for coming. And just in final, as we wrap up, just another final thanks to the members of the Criminal Justice Commission. Thank you for spearheading this initiative towards greater transparency at Louisville Metro Corrections. We really appreciate your support of this, and we're excited to continue to work together as we move forward. Thank you all very much.